Welcome again to the Medical Terminology Podcast. This episode is Chapter 5, Part 6, Procedures Related to the Cardiovascular System. Let's first start with some diagnostic procedures. And again, I'm going over these because they're ones that tend to get a little confused or mixed up. The first one is angiography, ANGIOGRAPHY. And this is the radiographic study of blood vessels after the injection of a contrast medium. Now, first of all, if we're talking about radiography or radiographic study, that's an X-ray. And the second point is this has the word part angio in it. And do you remember what angio refers to? Well, angio refers to the blood vessels in general. So angiography is the study of blood vessels in general. And angiography would be the process of studying. And if angiography is the process of studying, what would be the product that would come out of an angiography? Well, that would be an angiogram. ANGIOGRAM. Remember the difference between graphy and gram. A graphy produces a gram. That leads us to a related procedure, phlebography. PHLEBOGRAPHY. Now, based on the word parts, what does that mean? Well, phlebo, PHLEB/O, refers to veins. So phlebography would be a radiographic study of the veins. And in this case, it's a radiographic study of the leg veins after the injection of a contrast medium. And the contrast medium is injected into the foot. Okay, the next procedure is cardiac catheterization. Catheterization can be a little bit tricky to spell. It's composed of catheter, CATHETER, is, IZ, and then ation, ATION. And what this is a catheter is passed into the heart and the coronary arteries through either a vein or an artery. And a contrast medium is injected. This can be used to see how well the heart is working. Particularly, it's used to check how well blood is getting to the heart through the coronary arteries. And this general procedure can be diagnostic, just to observe and to determine how well blood is flowing. It also can be used as a way of doing a treatment procedure through the catheter. And the next term is the duplex ultrasound. Ultrasound is a method of visualizing using sound waves. Ultrasound can be used to visualize blood vessels, and if the ultrasound is combined with the Doppler ultrasound, Doppler allows you to actually see the motion of the blood in the vessels. A special type of ultrasound that can be done to observe the heart is the echocardiogram. ECHOCARDIOGRAM. Echo refers to the ultrasound, and cardiogram would be a record of the heart. So an echocardiogram is using ultrasound to visualize heart function. If Doppler is added to the echocardiogram, so you have Doppler echocardiogram, then you can see how the blood flows within the heart as well. And an echocardiogram needs to be distinguished from an electrocardiogram. ELECTROCADRIOGRAM. An electrocardiogram is measuring the electrical activity of the heart. It's used to check heart rhythms. And that's where they put the little electrode patches all over your chest, and then the wires run to a machine, and then it prints out a little chart how the heart is beating. And in our textbook, where it shows the different types of arrhythmias, such as the fibrillations and the tachycardias, they show us printouts that are from an electrocardiogram. And again, electrocardiogram is the printout itself, it's the record, and electrocardiography is the procedure for creating the electrocardiogram. That's it for the diagnostic procedures. There really aren't too many in the chapter. And then we have some treatment procedures. And again, I'm going to highlight the ones that tend to be confusing, that tend to be missed on tests, either because the meaning is confused or, again, spelling can sometimes be an issue. Some of these are kind of tricky to spell. Well, let's start out with anticoagulant. anticoagulant. An anticoagulant stops clotting. That is, it's a preventative to prevent blood clots. An example given in the book is Coumadin, Coumadin. That's a type of anticoagulant. And aspirin is also mentioned. It also tends to thin the blood and prevent it from clotting. Now, an anticoagulant is a preventative. It prevents clotting, and that is different from a thrombolytic, thrombolytic. Looking at the word parts here, we have thrombo and lytic. And remember, something that's a lytic is something that will cause something to break down. A thrombolytic causes clots that are already formed to break down and dissolve. Okay, that's different from an anticoagulant. An anticoagulant prevents clotting in the first place. A thrombolytic will help break up a clot that already exists. Okay, and they give an example of a tissue plasminogen activator as an example of a type of thrombolytic. The next term is vasodilator, vasodilator. And vasodilator is a medication that expands blood vessels. An example they give in the book is nitroglycerin, nitroglycerin, which can be used to treat the pain of angina. By expanding the blood vessels, more oxygen can get through coronary arteries, and that can ease the pain of angina. And then we get to some procedures that are related to clogged up vessels. First, we have angioplasty, angioplasty, and the word parts for that would suggest that angioplasty means the surgical repair of a vessel. And that's not really what it means. This is kind of a false friend. Angioplasty refers to the opening of a partially blocked coronary artery using a balloon on the end of a catheter. This is sometimes referred to as balloon catheterization. And so, if you remember, we had the term cardiac catheterization, which is the process of running the catheter into the heart, into the coronary arteries. Once that is done, and if a blockage is observed, then an angioplasty can be performed. Angioplasty is the process of sending the balloon through the catheter into the coronary artery. The balloon is inflated, which then causes the clot to be pushed open against the sides of the vessel. And there's drawings of that in the textbook. The main thing is to be clear on the difference between the angioplasty and the cardiac catheterization, because the catheterization is a broad term. It just means we're using the catheter in the heart. It could be used for diagnosis or treatment. but the treatment procedure, which involves catheterization, is angioplasty. The next term is an atherectomy, atherectomy. Atherectomy, it's got the word parts athero and ectomy. And this is the surgical removal of plaque buildup from inside an artery. Remember, athero just refers to plaque. Ectomy is removal, so we're removing the plaque. That's different from an arteriectomy, ARTERIECTOMY, which would be the removal of an artery itself, and that could be the removal of any artery. Atherectomy is specific to removing plaque from inside an artery. And then that leads us to the carotid endarterectomy. That's a little trickier one to spell. It's a long word. Carotid is C-A-R-O-T-I-D, referring to the carotid artery, which is a major artery that goes up through the neck up to the brain. And endarterectomy has three word parts: endo, E-N-D/O, arterio, A-R-T-E-R-I-O, and then our suffix ectomy, E-C-T-O-M-Y. Endo means within, arterio refers to the artery, and ectomy refers to surgical removal. So this is the surgical removal within the artery, or of the interior of the artery. Specifically, this is the surgical removing of the lining of an artery that is clogged with plaque. And if we're interested in the carotid artery, then of course it's the particular to the carotid artery. And this is a procedure for clearing out a clogged carotid artery to avoid a stroke. And it's important to note that we're not removing the artery itself. We're stripping out the lining of it, cleaning out the inner lining of all the plaque, and so blood can get to the brain. Okay, then we have two more treatment terms that are tricky to spell, that's why I'm going over them with you, that relate to aneurysms. And do you remember what an aneurysm is? An aneurysm, balloon-like enlargement of a wall of an artery, that's usually caused by a weak spot. And how can we treat these? Well, first of all, we have an aneurysmectomy. 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 Now, if you break that down, it's basically two word parts. We've got aneurysm, ANEURYSM, and then we have ectomy tacked onto it, ECTOMY. So based on the word parts, what's that going to mean? Well, that's going to mean the surgical removal of an aneurysm. The next term is aneurysmorrhaphy. ANEURYSMORRHAPHY. Now that looks long and intimidating, but again, let's break it down. It's really just composed of two major parts: aneurysm again, ANEURYSM, and then the suffix raphy. And we do have an O inserted in there because we want to avoid the double consonant of the M and the R. So they put an O in there. That's the little tricky part. O and then raphy, RRHAPHY. Well, again, based on its word parts, what is an aneurysmorrhaphy? An aneurysmorrhaphy is the surgical suturing of an aneurysm. They're stitching it up. Okay, that hits the high points and the scary points and the usually challenging points dealing with procedures. So let's go back now and do some practice. What is the term for a medication that stops blood clotting? That's an anticoagulant. Anticoagulant. And what would be an example of an anticoagulant? Well, we've got a couple of them. You could have said Coumadin, Coumadin, and also aspirin, Aspirin. Nitroglycerin is an example of what type of medication? That's a vasodilator. Vasodilator. And what does a vasodilator do? Well, it expands or dilates blood vessels. What is the term for the radiographic study of blood vessels after the injection of a contrast medium? That's angiography. Angiography. What is the term for study of the electrical activity of the heart? It tells us if the heart rhythm is normal or not. The process is electrocardiography. Electrocardiography. And the process of electrocardiography creates what? That's an electrocardiogram. Electrocardiogram. And what is the term for the opening of a partially blocked coronary artery using a balloon on the end of a catheter? Well, that's angioplasty. Angioplasty. And what is the term for the suturing of an aneurysm? Well, that's the aneurysmography. Aneurysmography. And what is the term for the procedure in which a catheter is passed into the heart through either vein or artery, and into the heart and into the coronary arteries? Then a contrast is injected in order to see how well the heart is working. Well, that's the cardiac catheterization. Cardiac, CARDIAC, catheterization, CATHERIZATION. And what is the term for the procedure in which the lining of a clogged carotid artery is removed? Well, that's the carotid endarterectomy. Carotid is CAROTID, endarterectomy, ENDARTERECTOMY. And what is the term for the procedure that uses ultrasound in order to visualize the heart function? Well, the procedure is echocardiography, echocardiography. And the procedure of echocardiography produces what? Well, that would be a picture or a record. That would be an echocardiogram. ECHOCARDIOGRAM. What would be the term for the extra effect or function that would be added in order to visualize the flow of blood? Well, that's the Doppler function, DOPPLER. And what is the term for removing an artery? That's the arteriectomy, ARTERIECTOMY. And what is the term for a radiographic study of the veins in the leg using an injection of a contrast medium? That would be phlebography, PHLEBOGRAPHY. And what is the term for the suturing of an aneurysm? Well, that's the aneurysmorraphy, ANEURYSM, aneurysm. Don't forget the O, and then Raphy, RRHAPHY, aneurysmorraphy. Okay, and finally, what is the term for the surgical removal of a plaque buildup from inside an artery? That's an atherectomy, ATHERECTOMY. Okay, well, that hits the high points of the procedures. At this point, we've come to the end of Chapter 5. Good luck to you on your test, and when you've completed your test, you can pat yourself on the back because you are now 1/3 of the way through the course. This ends this episode of the Medical Terminology Podcast.